Many rescuers have difficulty with adult chest compressions. The following are the main components for successful adult chest compressions. Expose the chest, landmarking, hand placement, body mechanics, depth, rate, recoil, and switching roles. The first step of chest compressions is to expose the chest, either by cutting the patient's clothing off with trauma shears or by pulling the patient's clothing from the waist up to the underarms. If removing the patient's clothing to expose the chest will delay chest compressions, then you may begin chest compressions over the clothes until the clothing can be removed around the compressor or trauma shears arrive. Some of you were originally taught to place your hand on the lower half of the breastbone just above the xiphoid process. Now BLS providers are taught to place the bottom of the palm of the hand on the center of the chest between the nipples. To find the center of the chest, slide the bottom of the palm of your hand gently back and forth, and you should settle onto the midline because it feels just a little bit different. This is where we will compress. This is our proper hand placement. To get here, place one hand over the other, it doesn't matter which one, and interlock your fingers. Your shoulders should be above the center of the patient's chest, and your elbows should be locked. This will cause your arms to be at or very close to a 90-degree angle. Lean with the weight of your shoulders down through the chest, using your waist as a hinge. Compress to a depth of at least 2 inches, but no more than 2.4 inches if using a chest compression feedback device. Your chest compression rate will be between 100 to 120 compressions per minute, aiming for 110. Allow the chest to fully recoil between each chest compression. If an AED has been applied to the patient, we switch every 2 minutes on the analyze. Before the AED is applied to the patient, we switch every 5 cycles of 30 to 2. If a provider is becoming too tired to compress effectively, or is no longer compressing effectively, we switch roles right away. BLS skills begin to deteriorate in 3 to 6 months. You do not need a full course every 3 to 6 months, but practicing some compressions and ventilations will keep your skills up between courses.